Good morning. Welcome to Patho with Miss Sue. Today we're doing chapter 26, Stress and Associated Problems. The stress response is a generalized response to changes either internally or externally. The role of stress in disease has become more established with the general adaptation syndrome, also known as fight or flight. This indicates that the body constantly responds to minor changes in its needs or environment, such as altered food intake or activity levels, and it helps to maintain homeostasis. The body has built-in mechanisms that quickly compensate for physiological changes in fluid balance or blood pressure. A is any factor that creates a significant change in the body or the environment. It can be physical, psychological, or a combination. A stressor may be real or anticipated, imagined, short-term, or long-term. Stress is considered to occur whenever a person's status is altered by his or her reaction to that stressor. Simply put, stress is a biological, psychological response that we experience whenever we encounter a threat that we don't have the proper resources to deal with. A stressor is a stimulus or threat that causes stress, such as an exam, the death of a loved one, loss of a job, and even moving into a new house. Sudden and severe stress generally produces things like increases in our heart rate, increases in our breathing, where our lungs dilate and bring in more oxygen. It'll decrease our digestive activity, and typically we don't feel hungry, and the liver will release glucose for energy. First, our body will judge the situation and decide whether or not it's stressful. This decision is made on sensory input and processing. So like all the things that we see and that we hear during the situation, or stored memories. What happened the last time we were in a situation like this? If we determine that the situation is stressful, then the hypothalamus will be activated. The hypothalamus in the brain is in charge of the stress response. So whenever a stress response is triggered, it's going to send signals to other structures such as the pituitary gland and the adrenal medulla. The flight or fight response will produce short-term responses. Each person can perceive stressors differently. A certain stressor for one person can be mildly exciting or stimulating, but for someone else, that same stressor can be deeply disturbing or depressing. It can even cause illness in some people. If the person is able to cope with the stressor, then the body would return to its normal status. If the person is unable or cannot adapt, harmful effects can result from the stress. This is often termed as distress. Severe or prolonged stress can cause dysfunction. It increases wear and tear on the tissues. It can cause us to exhaust our resources, and it causes exacerbation of chronic conditions. A vicious cycle can develop when the original stressor remains and the effects of the stressor prevent the body from coping with new stressors. If a stressor is extremely severe or perceived as a negative influence, or if multiple factors occur at the same time, the body's adaptive mechanisms may not work sufficiently. Then the body systems become more disruptive, maladaptive, or inappropriate behavior can occur, and homeostasis may not be possible for that person. Our body constantly responds to minor changes in the environment and maintains homeostasis. The body has built-in mechanisms that quickly compensate for physiological changes. Minor fluctuations in body function is normal. Slay developed the GAS concept known as fight or flight. And from that concept, he was able to show us that when a stressful situation occurs, the hypothalamus at the base of the brain is going to be activated. The hypothalamus in the brain is in charge of our stress response. When the stress response is triggered, it will send a signal to other structures, the pituitary gland and the adrenal medulla. The fight or flight response produces these short-term responses. The stressor activates the hypothalamus. The hypothalamus stimulates the pituitary gland. The pituitary gland will secrete adrenocorticotropic hormone known as ACTH. The ACTH will stimulate the adrenal glands and release the stress hormone cortisol. And like aldosterone, cortisol is a steroid hormone that is secreted from the adrenal cortex. You need to know that. Cortisol is a steroid hormone secreted from the adrenal cortex. Cortisol releases stored glucose from the liver to give the body energy. This allows the body to maintain a steady supply of blood sugar, and an adequate steady supply of the blood sugar helps a person cope with a prolonged stressor. It also can help control swelling after an injury. During this time, the immune system is going to be suppressed. The hypothalamus also activates the adrenal medulla, and the adrenal medulla is part of the autonomic nervous system and sympathetic nervous system. The adrenal medulla secretes the hormone epinephrine. You also have to know that. This hormone gets the body ready for the fight or flight response. The physiological reaction from the epinephrine being released includes an increased heart rate. Epinephrine leads to the arousal of the sympathetic nervous system and inhibition of the parasympathetic nervous system. Epinephrine released from that adrenal medulla will create changes in the body, such as decreases in the indigestion, but increases in sweating, the pulse, the blood pressure. Once the threat is over, the parasympathetic nervous system will take control and bring the body back into a balanced state. So to explain this just one step further, let's say you're walking through the woods, okay? And all of a sudden, this giant bear jumps out and scares the dickens out of you. What's going to happen? Okay? Your fight or flight is going to kick in. So that signal is going to be sent from the hypothalamus, okay, out to the adrenal cortex where cortisol is released. The adrenal medulla is going to release epinephrine. And now, as a result of that, your blood glucose is going to go up. Your digestive system is going to slow down. What else is going to go up? Heart rate, right? Your eyes will become dilated so that they can open and bring more light in. Your lungs are going to become dilated to bring more oxygen in. Thank God your digestive system slows down, because you're going to turn around and run from that bear. And you don't want to crap your pants while you're doing that. And then you get home, you run in the house, you slam the door, you're safe from the bear, and your parasympathetic nervous system kicks in now, and you're in the bathroom on the toilet. That digestive system flowing. All right, so this is how all that occurs. Now, Slay says there are 3 stages, and now we're going to talk about those. So, the first stage is going to be the alarm stage. During that alarm stage, body defenses are going to be mobilized by that activation of the hypothalamus, the sympathetic nervous system, and those adrenal glands. So, this is when that cortisol is being released by the adrenal cortex, that epinephrine is being released by the adrenal medulla. The alarm stage is happening when your body responds to that stress and that nervous system is activated, triggering those physical reactions that we just talked about. Now, in the second stage, or the resistance stage, your hormone levels are going to be activated. What hormones did we just talk about? Cortisol specifically, and we also talked about epinephrine. And your body systems are going to operate at a peak performance here. In the resistance stage, your body's going to start to calm down. Your heart rate and your blood pressure are going to go back to normal. And then we have the final stage. This is the stage of exhaustion, and this can happen when the body is unable to respond further or it is damaged because of the increased needs. All right, so here we will either have resolution or we'll have death. Okay, for this, I'm saying this over and over because you need to know this, okay? The stress response refers to the physiological and psychological changes happening in your body as a result of stress. This is also known as fight or flight response, or you may see it listed as the general adaptation system known by SLAY. The stress response involves a series of actions, including the hypothalamus and the pituitary gland, the sympathetic nervous system, the adrenal medulla, which secretes epinephrine, and the adrenal cortex, which is going to secrete our cortisol. Significant effects of the stress response include the following. So we have elevated blood pressure and increased heart rate. And this is caused by what? So remember to say this out loud to yourself over and over. We get that elevated blood pressure and that increased heart rate from the release of that epinephrine from the adrenal medulla. It's also going to lead to bronchodilation and increased ventilation to bring more oxygen into the lungs so that we can deal with this situation. And it's also going to bring more oxygen into the brain to make us more aware and alert. Will have increased blood glucose levels. And this is coming from the stimulation of the hypothalamus to the pituitary gland to release of that ACTH, and then stimulating that adrenal cortex to release that cortisol, increasing our blood glucose levels because we need an increase in these blood glucose levels so that we can deal with the stress. It brings energy to us. So that increase in the blood glucose level also comes from the liver. Glycogenolysis and gluconeogenesis are happening in that liver. We also have protein catabolism in the muscles, as well as lipolysis. Arousal of the central nervous system. Again, we need to be aware of what's happening. We'll see decreases in the inflammatory and the immune response from the release of that cortisol from the adrenal cortex. So all these things are happening in the body during this fight or flight situation. Now, that's a good thing, right? We want all these things to happen because this is going to help us deal with the situation at hand. This is our map of the stress response, and now we're going to try to go into it a little bit further so that you really understand it, okay? So when we have a fight or flight response or a general adaptation response, it produces both short-term responses to the stress and long-term responses to the stress. The short-term is usually going to be controlled by that sympathetic nervous system, whereas the long-term stress is going to be controlled by that hypothalamus to that pituitary gland. So hypothalamus to the pituitary adrenal gland system, that's known as hypothalamic pituitary adrenal system and or the axis, and we often abbreviate that as HPA, hypothalamic pituitary adrenal system, okay, HPA. And you might see in your book where it talks about stimulating or activating the hypothalamic pituitary axis. That's all it's talking about is the hypothalamus and the way it triggers and does things for the pituitary gland. That's on the right side here of this slide. And that's going to be more of your long-term effects for the stress control, okay? And then if you look on the left side, we're talking about the shorter-term effects that happen through the sympathetic nervous system and the adrenal medulla. And that is releasing those catecholamines. So we're going to talk more about all of this. All right. So first, let's talk about the stressor. It triggers the hypothalamus. And now for those long-term effects, the hypothalamus triggers the pituitary gland. All right. So the anterior pituitary gland is going to release the adrenal corticotropic hormone. All right. And that is also known as the ACTH. That will stimulate the adrenal cortex, and that is going to release cortisol, which is a glucocorticoid or a steroid hormone. The release of that cortisol is going to stimulate a few things. Okay, so first it's going to help with protein catabolism and gluconeogenesis, and that will increase our blood sugars, which is going to give us energy. That's going to help with stimulation of our central nervous system, and it's going to help us to have the energy to deal with the long-term effects of that stress. It can cause a delay in healing. So that's one of the disadvantages of it. But it also can help stabilize the cardiovascular system, and it can enhance the actions of norepinephrine and epinephrine. And we'll talk about that a little bit more when we get towards the posterior pituitary gland. It will increase gastric secretions, and that can sometimes lead to ulcers. So if we have prolonged stress, that's how that could lead to that. The release of the cortisol can cause inflammation to be decreased because we have a decrease in our white blood cells whenever we have cortisol release. So that's going to suppress our immune system, and it will decrease our antibody production. It will decrease our potential response to allergic reactions, and it can cause our lymph tissue to atrophy or reduce or shrink in size. So these are all things that we'll see when the hypothalamus is triggered, and it triggers that anterior pituitary gland to trigger the adrenal cortex to trigger the release of that cortisol. Now, the adrenal cortex can also stimulate the release of that aldosterone, and the reason being because we said that adrenal cortex releases aldosterone. We talked about that in a previous video. Fluid and electrolytes, I believe, is where we talked about that at. Remember, aldosterone helps us to save the salt, and the water is going to follow it. So aldosterone is helping us to withhold the sodium and the water. So remember down below, it said that the cortisol is going to enhance the catecholamine actions. So how does aldosterone do that? So if the aldosterone helps us keep the sodium and the water, then it can help increase the blood volume and the blood pressure, something that our catecholamines, norepinephrine and epinephrine also do. They also help us increase our blood pressure. All right, so now let's look at the posterior pituitary gland. So the hypothalamus also will trigger the posterior pituitary gland here. This will cause the release of ADH. And as we've talked about ADH in the previous video of fluid electrolytes, you know that ADH helps with water reabsorption. So if the water is reabsorbed, that is going to help with our blood volume, and it's going to help increase our blood pressure. And we also stated that both norepinephrine and epinephrine would help increase our blood pressure. So as you can see, all of these things are working as a team together. Now on the left side of the slide, the hypothalamus for those short-term effects is triggering that sympathetic nervous system. All right, so it's going to secrete the epinephrine, all right, from that adrenal medulla, and norepinephrine. And they're both going to be released into circulation. Now, epinephrine is going to help with vasoconstriction of the skin, so those cutaneous areas, the kidneys, all right? The GFR is going to be decreased here, so kidneys aren't filtering as well. We'll have vasodilation of the skeletal muscle to help increase the function there. Our heart rate force is going to be increased, and that's going to help increase our blood pressure. And then we're going to have bronchodilation, which is going to increase the oxygenation level to the lungs, help ventilate it, and to the brain to help make it more alert. It will also, that bronchodilation will stimulate the central nervous system. It will increase our muscle tone. And then epinephrine will also help with glyconeogenesis, lipolysis, and gluconeogenesis to help increase the blood glucose. So again, you're seeing a full circle here of team effects. How is this going to help the person? All right, so all these changes you're going to see in the body, and you really want to know what the changes are What causes the changes, and how does that work? The stress response is also going to increase the release of endorphins, and those endorphins will act as pain blocking agents. In some cases, when an illness requires additional treatment like hospitalization or physiotherapy, extra stressors are added, and these can overwhelm the patient. Hospitalization can induce fear in the client and pain or anxiety associated with things like separation from their family or their job. With prolonged or major stress, intellectual function and memory are often disrupted. This is just a basic slide to look at some of the things on here that might happen. So, that increase in blood flow to the brain, that pupil dilation, that increase in the heart rate, that faster, deeper breathing, that increased blood flow, the release of that cortisol to help with our energy, that digestive system slowing down here, the increase in the blood sugar, in the blood pressure, the increase in our alertness. So just look at, some of these things. These are things that you want to know. But especially what I just went over on that previous slide, that's the ticket right there because that's right from your book and that's what you would expect to see in someone during fight or flight. Responses to stress can be positive or negative. So, whenever you have positive stress, it's considered eustress. This is stress that's inspiring or encouraging, and it can promote long term health. This type of stress can be associated with motivation, efficiency, creativity, attention, and focus. So, normal stress would be something like you're planning a wedding, okay? The normal stress and things associated with that. Of course, unless you're getting married to a bridezilla. Negative stress or distress is when the person cannot adapt and harmful effects can result from that stress. We also have techno stress. I would know what this is. Okay, this is stress that's the result from the use of information and communication technologies. And some of you might actually feel this, right? When you're trying to work with your computer or work with that Microsoft Office or work with things that you're not familiar with, now you have to come in, you have to upload care plans and do vSIM things that you're not used to. Okay, so people expect you to know how to use certain tools in business. You're going to have to know how to use computers and things. And then also some of the stress that we see just out there in generalized society. What happens when you see people sitting at the table, like having dinner with one another? They're not even looking at each other. They don't even know what each other looks like because they're looking at the phone. They're not communicating. They're both in their own little world on their phone. Same thing with kids and toddlers. The parents just hand them the electronics to shut them up, and they're sitting there on these electronics for hours, and they don't know how to communicate or socialize in general. And then they can use certain technology, but not other. So techno stress is going to occur more prevalent in the older person because they're more likely to struggle with using things like email, using computers, or using certain programs. Stress can lead to specific problems such as a headache, which can develop during the stress response or in some people as the stressor is relieved. Prolonged vasoconstriction can lead to inflammation and necrosis that lead to things like stomatitis or ulcers in the mouth and necrotizing periodontal disease or nausea. Other severe complications can occur if the reduction in blood supply impairs the function or causes necrosis in areas like the GI tract or the kidneys. Stress has also been shown to be a precipitating factor in several disorders. Chronic infections like herpes simplex can erupt when the person is stressed. So, like, it's coming near the prom or a wedding or even exam time, and you start to develop cold sores that erupt. Acute asthma attacks or seizure disorders can be triggered in some people during stressful situations. The onset of cancer or infections often follows a series serious life crisis, which suggests that the immune system has been depressed. In several chronic disorders, stress is an exacerbating factor. It's important for the person with a chronic illness to develop improved coping techniques and an adequate support system to delay exacerbations or progressive degeneration during chronic illness. I would take a close look at this table because sometimes they'll ask you about diseases that are correlated with stress. In some diseases, such as hypertension, coronary artery disease, or diabetes, stress is believed to be a causing factor. It's also been noted that elevated cholesterol levels occur during stress, and the reactive vasoconstriction can affect blood pressure and blood vessels if stress is sustained or occurs for a long period of time. So here you see we have the GI system where they can have ulcers, ileitis, diarrhea, stomatitis, periodontitis. You have the nervous system, which can be affected. So this can happen in people with autoimmune disorders or other issues. You have the respiratory system, which could be affected. So just take a close look at this and be aware of how these things affect the body or how these are affected during times of stress. Severe stress can lead to a variety of serious complications such as renal failure or perforating stomach ulcers. Acute renal failure comes from prolonged severe vasoconstriction and a reduction in the blood supply to the kidneys from that stress response. Remember, there's vasoconstriction there. Reduced blood supply leads to tubular necrosis. So this means those tubules are going to be killed, like the tissue in there. If it's necrotic, that means it's not working, right? And if the tubules aren't working, then that means that they're not filtering the urine and removing the waste. So remember that in the tubules, this is where the fluid is filtered, and then anything that we need, like electrolytes, and water is returned back to the circulation system. Anything that we don't need, like those nitrogenous waste, are removed. Also, if we have damage in those tubular areas, can that cause other things to occur, like protein or blood to leak out? So you have to think about that part as well. We can also have obstruction of the filtrate. Remember, the filtrate is that urine. So the urine flow is now not going out either. What's going to be happening as a result of that? Think about that. We'll have cessation of the glomerular filtration or failure of the glomerular filtration. So again, we're not removing those waste. We're not reselecting those electrolytes to put them back into circulation. We're not reabsorbing water that we need to if this filtration process isn't working correctly. And also we'll see a decrease in the circulating leukocytes, and this can affect our immune function and also depress our inflammatory response. Stress ulcers can develop with severe trauma. A good example is a curling ulcer. This sometimes develops in people that have severe burns. Stress ulcers are multiple gastric ulcers, and they're often asymptomatic, but they can be dangerous because they can lead to gastric bleeding or hemorrhage. We can have intense vasoconstriction in that gastric mucosa, and that's going to decrease the ability of the mucosa to regenerate or reproduce. We'll see decreases in the motility. Remember, we said that digestive system is going to be slowed down. So this decrease in that motility causes the chyme just to sit there in the stomach. We also may see catabolic or breakdown, okay, from those glucocorticoids that are being produced from that cortisol. And this can cause a delay in the ability of the tissue to regenerate or heal. And all of these things together are going to lead to that ulcer formation. Another potential complication of severe stress is infection, and this is related to the depression of that inflammatory response and that immune system, again caused by the increase in the secretion of that cortisol from the adrenal cortex. Because the body mechanisms are reduced, opportunistic infections can develop, and the person is susceptible to infection by unusual organisms that are not normally pathogenic. The lack of the inflammatory response can mask the sign of the infection until it's well developed in someone. So that can also be a dangerous situation. Continued stress impedes the healing of tissue after trauma or surgery. There are two major factors involved. First, the hypothalamus triggers the adrenal cortex to release increased amounts of cortisol. These increased amounts of cortisol reduce the body's ability to synthesize protein and to regenerate tissue, and that impedes or delays the healing process. The adrenal medulla releases catecholamines, epinephrine and norepinephrine. The increased release of these catecholamines leads to vasoconstriction, a reduction in the blood supply, and a reduction in the delivery of nutrients to the area that suffered the trauma. These effects can lead to increased risk for infection and increased amounts of scar tissue at the site of the trauma or where the surgery occurred. In clients with post-traumatic stress disorder has been recognized as a serious consequence of any major disaster. The syndrome usually occurs within 3 months of the traumatic event, but it can cause symptoms years later. 3 categories of symptoms can occur: revisiting or reliving the event, avoidance of certain activities and a lack of appropriate emotional response, and a dissociative state in which the person is non-responsive. In a dissociative state, the person feels like they're actually outside of their body and looking in it from the outside. There's also a high risk of the person with post-traumatic stress disorder developing dependency on drugs or alcohol in order to cope. To prevent stress from becoming distress or a negative influence, each person has to recognize things that induce stress in them and discover the best way to deal with it. This has to be done both emotionally and behaviorally. People have to take appropriate action to develop improved coping techniques if the stressor cannot be removed. Fatigue, age, inadequate nutrition, lack of knowledge, and lack of emotional support are all factors that can interfere with an appropriate response. This concludes this lecture.